Hello everyone, my name is Elizabeth Serwaa. The topic I'll be exploring is one that blends food, health, equity, and sustainability. It's called Food as Medicine, and in this presentation, I'll explain how sustainable agriculture can reduce health inequities, especially in marginalized and rural communities around the world. We often talk about medicine as something that comes in a bottle or through a hospital, but what if healing could start with what we eat and grow? What if the food itself could be a part of the solution to health injustice? That's the big idea that I want to share with you all today. Before I start, I would like to tell you all a little bit about myself. I'm a rising senior at Hayfield Secondary School in Alexandria, Virginia. And as for my extracurriculars, I am the service coordinator at my school's National Honor Society. I attended Virginia's Governor's School for Agriculture this year. I also am a participant in Black Girls Ambassador Program, where we work to amplify the voices and experiences of Black girls in health and education. I'm currently creating a menstrual hygiene storybook for rural African communities through the HEART program. And during the school year, I tutor in chemistry, math, and Spanish. And lastly, I am a youth service leader and church choir founder at my church. As for my passions, of course, I'm passionate about public health, sustainable agriculture, and health equity. For my future goals, I aim in becoming a neuro-oncologist, which is a doctor who specializes in diagnosing and treating brain cancer. Before we start, I would like to talk about why this topic matters. Across the world, especially in rural or underserved areas, people face serious health challenges due to poor food access. When food is low in nutrients or unsafe, it leads to malnutrition, obesity, and diseases like diabetes or heart failure. That's a health equity issue. It's not just about what people eat, it's about what they can eat. Sustainable agriculture offers a solution. It prioritizes food that's not only healthy, but also safe and culturally appropriate. And that's what we'll explore today. How sustainable agriculture, powered by education, technology, and economic support, can become a global health strategy. Let's look at the problem more closely. In many rural areas, people can't access diverse, nutrient-rich crops. Urban areas, especially in the U.S., have food deserts, where fresh produce is nearly impossible to find. These gaps in food access cause long-term health problems that deepen existing inequalities. This map shows rural food access in the U.S. The darker areas represent regions with the least access to healthy foods. Notice how these areas overlap with South and Southwest, which are regions with high poverty and poor health outcomes. And this just isn't an American issue. Rural communities in sub-Saharan Africa, South Asia, and Latin America face similar challenges. When people can't access nutritious food, their health suffers and their opportunities shrink. Now let's look at how sustainable agriculture is a part of the solution. It encourages growing a variety of crops without harmful chemicals, making food safer and more nutritious. It respects cultural food preferences, which increases community acceptance. And it also protects resources like soil and water so that future generations can continue to grow healthy food. When communities have tools and knowledge to grow their own safe, diverse food, they gain power over their health and futures. Now the big question is, how do we promote this kind of agriculture? First, education. Hands-on experiential learning, such as farm training programs, teaches people how to grow crops that are both nutritious and sustainable. This isn't just a theory. It's about real-world skills that reduce health risk and strengthen local food systems. This connects to David Kolb's theory of experiential learning, which is the circle image on the slide. This theory emphasizes learning through experience, reflection, and experimentation. When farmers learn by doing, they're more likely to apply and adopt these practices in their communities. Second, technology. Tools like precision agriculture helps farmers grow more food with fewer chemicals. This improves food safety and supports small farmers who often can't afford to waste resources. Third, economic incentives. Farmers need support to switch to sustainable practices. Grants, subsidies, and better market access make it financially possible to grow healthy food. Without this, sustainable farming stays out of reach for many. When combined, these three strategies, education, technology, and economic incentives, can transform agriculture into a force for healthy equity. So what's the big takeaway? The big takeaway is that if we want to reduce global health inequities, we need to think of food as medicine and invest in systems that help people grow that food sustainably. Sustainable agriculture backed up by education, technology, and economic support, empowers communities to take control of their health. The call to action is to support policies that make sustainable agriculture a reality, and to advocate for funding, education, and innovation that prioritizes food quality and community well-being over just profits. And here are my references. Lastly, I want to give a big thank you to the amazing teachers and mentors at Virginia Tech and for the Virginia Governor School of Agriculture who helped shape this research. I also want to say thank you to the local farmers and global communities whose resilience continues to inspire this work. And of course, thank you to the Global Health Leaders Conference for giving me this platform. And here's my contact information for anybody who has any questions. And thank you all for listening. Bye. Thank you so much.